Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. In this segment, we're going to be speaking with Dr. Peter Cathcart. He's internal medicine specialist in Nashville, Tennessee. He's joining us on the program to talk about his experience using the NextGen Mobile app on his phone to access homeless patients' medical records, prescription lists, appointments, and detailed care plans from previous providers. Welcome to the program, Dr. Cathcart. Thank you for taking the time.
Thank you for having me, Mr. Howard.
Well, an internal medicine specialist, give us a look into your professional background, what drew you to medicine, and what exactly is it that you're doing now in Nashville?
Yeah, I'm an internal medicine pediatrics physician. Got drawn into it actually because of cardiology on VA wards when I was a fourth-year med student of all things, and my attending was a med peds physician. He said, this might be the best thing for you, as I was leaning towards pediatrics at the time and haven't really looked back since. I did my residency at the University of Minnesota, was a chief of internal medicine at Regents Hospital there, and then came down to Nashville after residency, and now find myself working in at neighborhood health, and definitely loving the population that I get to see at an FQHC.
The homeless population faces a wide variety of challenges, not the least of which, of course, is medical care. What is the state of medical care just in Nashville among the homeless currently?
Yes, sir. Our patients who are experiencing homelessness number about 2,000 per our last estimate. And we anticipate that number to continue either to grow or stay steady over the next year. But we have one dedicated clinic in the downtown area actually devoted entirely to our unhoused population. And what that clinic does is actually provide laboratory services and a dispensary for standard medications to treat things such as hypertension, hyperlipidemia, infections, and provide as a gateway for them to access specialty care if they need it, whether it be for something as severe as colon cancer or something as trivial as needing a mold checked by dermatology. But that clinic is staffed by 3, about to be 4 wonderful providers, Dr. Suzette Kelly, Dr. Afshan Kermani, and Dr. Ashley Sadeth, and they help that population day in and day out. And then we have referral specialists and specialists who particularly know ways and means to assist with patient navigation, with applying for medications and such that they may need. And then Crystal Wolverton is probably the queen bee of them all, who has ins and outs with various other organizations here within Nashville to provide assistance with getting to rehab and getting into potentially finding gateways for them to actually start transitioning into housing.
The term street medicine, is that a term that you coined, and is it taking place in several other cities?
The phrase was termed by Dr. Jim Withers out of Pittsburgh, and it's been one of the leaders of this movement that's actually been in place in many other cities before it arrived with our organization here in Nashville. There's programs out in Chicago, Detroit, New York, LA, with the Keck School of Medicine has one of the best programs, and I always rely on their resources, and I'll always listen to their presentations when they give them. And there was recently a street medicine symposium that was held this past weekend virtually that provides a wealth of information. And many of these groups are led by MDs, DOs, NPs, PAs, and interestingly enough, a large component of them is affiliated with teaching hospitals, and med students are providing a lot of care and learning a lot more about that, how to deliver care to patients experiencing homelessness through street medicine programs at various med schools across the nation.
How has NextGen's mobile app been instrumental in you doing what it is that you do for this homeless population?
Yeah, for me, NextGen Mobile allows me to take a look at a patient who has been receiving care for years at our downtown clinic as far back as 2008 and look back on what they've been treated for, whether it be something such as hepatitis C, hypertension, diabetes, and be able to pull up their laboratories and see how well controlled they are if they've had a lab within the last year, assess their blood pressure when they were in clinic last, maybe about 6 to 12 months ago, and take a look at the patient as a whole and not have to take the patient for just what they're giving me in that snapshot of time. And so the other thing it lets me do is it lets me see their medications that they either were on or have been on in the past, along with allergies and even radiology reports, to the point where I'm able to give appropriate care based on what I'm seeing at that moment in the field, based on their past medical history, not just what they have in that given time.
It would seem that this mobile technology is kind of key to effective street medicine.
Yes, sir. For me, I mean, I think about the times where, well, one, I've treated a rash or cellulitis, and I'm able to see the evolution by taking a picture, uploading it directly to my phone. It stays with that patient's medical record, and I can look back and say, the cellulitis has improved. Or another team member, such as Mary Prisco, can go out. She might see the same patient 2-3 days later, and she's like, I know Dr. Cathcart put you on antibiotics. Can I see your rash or see what your skin looks like now? And she's able to make the call to say whether that patient has failed outpatient therapy and we need to start transitioning them to the emergency room, or, oh, that cellulitis looks improved. We can keep you on this antibiotic and we can follow up next week. The ability to deliver that continuity of care, and even as the week progresses in this population, is also completely crucial, because then it limits their ER utilization and definitely improves their overall quality of care they're getting.
Talk about some of the unique challenges that the pediatric population in this community faces. And is that something that can be addressed using this same technology? Yeah,
that's a very interesting question. We have treated patients on street medicine who are in the peds population, and the hardest part is actually being able to access those records. Some of these patients have been seen in clinics by other providers before, and so we are able to see if they've had the necessary vaccinations. We're able to see if they've had the appropriate screenings that they need to enter school. And what it also allows us to do is then to ensure that they're getting proper care, because even at that level, a lot of times those kids they're hidden in a way. And so when you do gain the trust of the patient and their parents, most times there's a large amount of trust they're placing in you to not only keep their kid safe, but also to keep their child and that patient healthy. And having those records on hand, whether or not they've been treated for asthma or eczema in the past, is crucial, because then we're able to on-site dispense something like as simple as albuterol for that pediatric patient, or we're able to arrange for something like vaccinations, or for them to speak to a patient navigator for them to get enrolled in insurance if they're uninsured at that moment.
Well, if you would, give us a website where we can learn more about street medicine in Nashville.
Oh, neighborhoodhealth.com is the best, where we can learn more about that. We're still trying to build our social media presence around it. Rob Montez is devising a plan there. And then I know with NextGen Mobile, you can just go to nextgen.com and look at their mobile solutions, and they'll talk to you about that if you ever need to speak to a representative, or if you ever want to reach out to me, feel free to send me some questions about NextGen Mobile and how it's helped me within the realm of street medicine and also in my traditional patient practice.
Well, Peter, I appreciate you joining us here on the program this morning. It's been a pleasure speaking with you.
Yeah, thank you, Mr. Howard, and appreciate you having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Peter Cathcart. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.